Asthma is a chronic respiratory disease. It affects the airways in your lungs. These airways are like tubes that carry air in and out. During an asthma attack, the airways become inflamed and swollen. They produce extra mucus, making it difficult to breathe. The Global Initiative for Asthma, or GINA, is a leading organization in asthma care. GINA defines asthma as a condition characterized by recurring respiratory symptoms. These symptoms include wheezing, shortness of breath, chest tightness, and coughing. The severity and frequency of these symptoms can vary from person to person. Asthma can affect people of all ages. It is one of the most common chronic diseases in children. However, adults can also develop asthma at any age. With proper management, most people with asthma can live normal, active lives. Asthma affects millions of people around the world. It is a global health concern. The prevalence of asthma varies widely across different regions and populations. Factors such as genetics, environment, and lifestyle can influence asthma rates. According to the World Health Organization, an estimated 262 million people globally had asthma in 2019. Asthma is more common in developed countries, likely due to factors like air pollution and indoor allergens. However, asthma rates are increasing in developing countries as well. In the United States, approximately 25 million people have asthma. That's about 1 in 13 people. Asthma is particularly prevalent among children, affecting about 6 million kids nationwide. It's important to note that these are just estimates, and the actual number of people with asthma could be higher. The exact cause of asthma is unknown. However, we do know that a combination of genetic and environmental factors plays a role. Genetics can make you more susceptible to developing asthma. Environmental factors can trigger asthma symptoms or make existing asthma worse. Endogenous risk factors are those that come from within your body. These include family history of asthma. If you have a parent or sibling with asthma, you are more likely to develop it. Allergies to things like pollen, dust mites, and pet dander can trigger asthma symptoms. Respiratory infections. Severe respiratory infections in childhood, such as respiratory syncytial virus or RSV, can increase the risk of developing asthma later in life. Environmental risk factors are external factors that can contribute to asthma. These include air pollution. Exposure to pollutants like ozone, particulate matter, and nitrogen dioxide can irritate the airways and worsen asthma symptoms. Tobacco smoke. Smoking and secondhand smoke are major triggers for asthma and can also increase the risk of developing the disease. Indoor allergens. Dust mites, cockroaches, mold, and pet dander are common indoor allergens that can trigger asthma symptoms. Asthma triggers are things that can irritate the airways and cause asthma symptoms to flare up. It's important to identify your personal triggers to avoid them as much as possible. Common asthma triggers include allergens. Pollen, dust mites, pet dander, mold, and cockroaches are common allergens that can trigger asthma symptoms. Irritants, tobacco smoke, air pollution, strong odors, and fumes can irritate the airways and worsen asthma. Respiratory infections, colds, the flu, and sinus infections can trigger asthma symptoms. Exercise-induced asthma is triggered by physical activity. Weather changes, cold air, dry air, and sudden changes in temperature can trigger asthma symptoms. Stress and strong emotions. Stress, anxiety, and excitement can trigger asthma symptoms in some people. Certain medications, aspirin, ibuprofen, and other NSAIDs, can trigger asthma symptoms in some people. Section 5. The science behind asthma. During an asthma attack, the airways become inflamed and constricted, making it difficult to breathe. Here's a closer look at the pathophysiology of asthma. 1. Inflammation. When exposed to a trigger, the immune system overreacts in the airways of people with asthma. Cells in the airways release inflammatory substances like histamine and leukotrienes. 2. Bronchospasm. These inflammatory substances cause the muscles surrounding the airways to tighten, leading to bronchospasm. This narrowing of the airways restricts airflow. 3. Mucus production. The inflamed airways also produce excess mucus, which can further obstruct airflow. This combination of inflammation, bronchospasm, and mucus production leads to the characteristic symptoms of asthma, such as wheezing, shortness of breath, chest tightness, and coughing. Section 6. Recognizing asthma symptoms. Asthma symptoms can vary from person to person. Some people experience symptoms only occasionally, while others have them regularly. Symptoms can also range from mild to severe. Common asthma symptoms include wheezing, which is a whistling sound when you breathe, especially when exhaling. Shortness of breath, feeling like you can't get enough air. Chest tightness, feeling like your chest is being squeezed or compressed. And coughing, especially at night or early in the morning. During an asthma attack, these symptoms can worsen and become severe. Signs of a severe asthma attack include difficulty speaking in complete sentences, a bluish color to the lips or fingernails, rapid breathing and heart rate, and severe chest pain. If you or someone you are with is experiencing a severe asthma attack, call 911 immediately. Section 7. Different types of asthma. Asthma is not a one-size-fits-all disease. There are different types of asthma, categorized based on symptom severity, triggers, and other factors. Common types of asthma include intermittent asthma, where symptoms occur less than twice a week and nighttime awakenings due to asthma are rare. Mild persistent asthma, where symptoms occur more than twice a week but less than daily, and nighttime awakenings due to asthma occur a few times a month. Moderate persistent asthma, where symptoms occur daily and nighttime awakenings due to asthma occur more than once a week. Severe persistent asthma, where symptoms are continuous and nighttime awakenings due to asthma are frequent, significantly limiting daily activities. Other types of asthma include allergic asthma, triggered by allergens like pollen, dust mites, and pet dander. Exercise-induced asthma, triggered by physical activity. And occupational asthma, triggered by substances encountered at work, such as chemicals, dust, or fumes. Section 8. Diagnosing and managing asthma. Diagnosing asthma involves a combination of medical history, physical exam, and lung function tests. Your doctor will ask about your symptoms, triggers, and family history. They will also listen to your lungs and may order tests to assess your lung function. Managing asthma effectively involves avoiding triggers by identifying and avoiding your personal asthma triggers as much as possible. Medications, where your doctor may prescribe medications to control inflammation and open up the airways. These medications come in two main types: controller medications, taken daily to prevent asthma symptoms, and reliever medications, taken as needed to quickly relieve asthma symptoms. Additionally, work with your doctor to create a personalized action plan that outlines how to manage your asthma daily and during an asthma attack. Section 9. Take charge of your asthma. Living with asthma can be challenging, but with proper management, you can live a full and active life. Remember these key points. Asthma is a chronic respiratory disease that causes inflammation and narrowing of the airways. Triggers, both environmental and internal, can cause asthma symptoms to flare up. Recognize the symptoms of asthma and seek medical attention if you experience them. Work with your doctor to develop a personalized asthma action plan. Take your medications as prescribed and avoid your triggers to manage your asthma effectively. By taking an active role in managing your asthma, you can breathe easier and live a healthier life.